Hey, my name is Sheila Paizielen. I am the coordinator of TTCriders, and today I'm speaking with Zainab Hussein, who is a recent graduate of the Masters of Environmental Studies at York University. And TTCriders is doing a series of interviews and panel discussions during COVID-19 about public transit. So we're so happy to be interviewing you today. How's it going?
It's going good.
Awesome. Yeah, first of all, just wanted to ask how you're doing in the pandemic and
I'm doing
anything.
well.
Yeah,
I'm just trying to keep calm.
awesome. Thanks so much for talking with us. I wanted to ask you, first of all, just about your experience taking TTC in your part of the city and the issues facing your community where you commute.
So yes, I'm a regular TTC user. I also live in the west end of Toronto. I live in Ward 1, Etobicoke North, but I live closer to Ward 2, Etobicoke Centre. Taking the TTC from my neighborhood is difficult. I find myself traveling from one bus to another. I mostly travel within the inner suburbs of Toronto. I'm not close to any subway stations. I completely depend on the bus to get to places. I just graduated from York University. I'm traveling there to meet up with friends or visit the Career Center. Traveling to York University from my neighborhood is difficult. I have to take 3 different buses to get to York University. All 3 buses have their own wait time. I always prepare myself for a very long commute. I always drive to York University, exhausted and annoyed. I wish we had one transit fare that would allow us to use all the public transportation that is available within Toronto. I live in the inner suburbs and I'm surrounded by GO stations and GO buses. For example, I live near Tobico GO station, but I never use it because it requires a different type of fare. I also live near Renforth GO station, but I never use that to travel to go on the GO buses to get to York University. And I just think my neighborhood doesn't really have the best transit because we're not necessarily in a station and we're just given buses as a way to get to places. And I feel like if we the lack of investment on subways and just buses being not coordinated properly causes me so much frustration because I just don't get to anywhere. And even with the GO buses, like I remember and GO stations, I remember commuting to the CNE for work in the summer and taking the TTC. I would prepare every day for a 2-hour commute. One of my coworkers who lived in Mississauga would take the GO station for port credit to the exhibition GO station. She asked me one day why I never took the Kipling GO station to exhibition GO station to save time on commute. I realized then that life isn't fair. I believe the biggest issue that our community faces is the cost of public transit. I live in a low-income community. My low-income community cannot afford the rising cost of public transit. This leads to people staying home and not going out as much to save money, or people evade fare. Another problem in our community faces is that we live in the inner suburbs and not being properly served by the TTC because we're too far out. We're also not being properly served by the regional transit system because we're also too far in. This problem has been previously identified by Douglas Young and Roger Keel's 2010 studies called the Reconnecting the Disconnected, the Politics of the Infrastructure in the In-Between City. They call this the in-between city, the inner suburbs, because we're not necessarily in the city core, but we're not also in the suburbs as well. And yeah, I just feel like we could have better transit if more investment was done in terms of stations. And I know Eglinton GO stations coming in. I know the Finch GO station, the Finch LRT is going to come on. But even if the Finch LRT comes in, I still don't even live close enough to access it because I live Martin Grove and Eglinton, so I wouldn't be benefiting from it. And the Eglinton LRT stops at Mount Dennis. I still have to travel multiple buses to get to both of these LRTs. So I still feel we're not even being properly serviced even with the new development that's coming in.
And I mean, it's right now it's April 6th. And just a few days ago, what you were saying about not being able to access Go because of the high fare, just a few days ago, the Go TTC discount fare for people commuting between TTC and Go Transit was cut. I think we're not hearing about it a lot right now because there's so few people taking the Go and TTC, but people are now, you know, it was unaffordable before, but now people are paying $3 more a day and over $700 more a year to use both Go and TTC. Yeah, thanks so much for that. And I guess I wanted to ask you before, you know, you wrote your master's thesis about transit, so we're going to get into that. But first, I wanted to ask you a bit about how the COVID-19 pandemic is affecting your transit use or your family's transit use right now.
My family and my community all had to make adjustments when taking public transit during this COVID-19 virus outbreak. I try to go on the bus after 12 p.m. I try to avoid busy rush hour times. Most of my travel is between the inner suburbs, and therefore most of my travel is on a bus. My only problem is the wait time for buses. It takes me 3 buses to get to the nearest Walmart. I travel to Walmart to buy my baby milk or diapers. My mother adjusted her travel on the TTC by making sure she only travels out of necessity. She used the TTC on Friday to go buy groceries and halal meat. Her biggest complaint was that people were not practicing social distance on the Jane bus, and that one woman was close enough to her so that she could touch her. My youngest sister went with my mother to help her carry the grocery bags. She worried about touching the poles. She always carries a hand sanitizer with her. She also tries not to touch the pole with her bare hand. My family worries about getting COVID-19 because our dad is 65 years old. He's considered an older adult. We do not want him to get COVID-19. I guess since we travel on the TTC, we always worry about catching it on the TTC. I feel like where else would we get it? You know, we have gloves on, we have like face masks on, but at the same time, you never know who's too close to you, or you never know anything. You never know if the virus is where it's spreading, and so you get anxiety. Yeah. Like I actually get like a panic attack and think it's gonna come to me. When I come home, I'm like, I have it. But you know, it just really it's not the greatest time, and the public transit makes you really feel like it's a public place.
Totally. Yeah, and that's why it's so important for the TTC to continue to run enough service to maintain physical distancing on those routes, and especially if you're having to take 3 different buses to get to do your groceries. You know, if those buses are crowded, then you're coming too close to people. Yeah, thanks for sharing that. And I guess this is related to like the enough bus service is really related to what you wrote your master's thesis on about the Somali community and their experience on TTC. So I just wanted to ask you, you know, some of the key lessons and takeaways that you learned from your research and how you went about doing your research for your master's project.
So when I started my research paper, I had an intention to do qualitative interview because I wanted to hear the stories of the Somali community. I wanted to hear the problems that they had. I was inspired by C. Wright Mill's sociological imagination that one person's problem is a private problem, but if enough people have the same problem, it is a public problem, and therefore you have to look at the social construct that causes these problems to exist. So my goal was to do qualitative interviews, and I conducted 4 focus groups within the Somali community in Toronto to ask them what were the biggest problems they face. So the biggest problem the Somali community faced, number 1, was the cost of public transit. 3 out of the 4 focus groups that I conducted complained about the cost of bus fare. One respondent felt that his community did not receive anything to justify the rising cost of public transit. Another respondent saw the cost of public transit and as an extra expense that she had to put up with. The second biggest problem is overcrowding. 3 out of the 4 focus groups that I conducted complained about overcrowding. Several respondents complained about overcrowding on the subway. Another respondent complained about the overcrowding on the bus. The third biggest issue is the Somali community not being involved in transportation planning and meeting. Several respondents felt like their community was not included in transportation plan discussion. Another respondent believed that the community does not know they have access to join transportation planning meetings. Public transit officials need to be aware of the social economic background that the Somali community comes from. My research found that the Somali community are mostly a low-income community, and they mostly live in government housing. Public transit officials should reduce public transit for low-income communities. Public transit officials should reach out to the Somali community. And I feel like when you know the problem that Somali community faces is the biggest problem being the cost of public transit, because the Somali community mostly has lots of kids. They're mostly big family, and so the father probably doesn't have a good job, or the mother doesn't even have the father in the home, and therefore you have all these people that live in government housing predominantly that need to get to places and that use public transit. And the problem is they're finding that the public transit in their community is not doing enough service, or like they're just not coming, or if it comes, it's just too full. And so what you have is you have a group of people that are either frustrated with public transit, so what they do is they stay home a lot, they don't go out too often, and now they start to use Uber to commute on shorter trips, or they go on the buses and they complain that one day when they have enough money they'll get out and they'll never have to use this transit. So I feel like TTC is not making the poorest people happy. It's making them self-loathe. It makes them feel like this, like they take it in that it's because they're poor that they're getting the worst services on public transit. You know, like I remember my brother, he would go to work and every day he got so frustrated that he would ask my dad to drive him because the buses wouldn't come together. Or even he would ask my dad to drive him to Kipling Egerton. So we live at Martin Grove and Egerton, and it takes us 3 buses to get it takes us 3 buses for him, because I guess he was traveling to Kipling condos in the Kipling because he was a security guard there, and it took him a long time to get to work. So he would tell my dad to drive him to Kipling Egerton so he could take 1 bus instead of taking 3 buses to get there. And I feel like when you live in these inner suburbs, the biggest frustration is not getting to work on time, it's not getting to school on time. So you either accept being late all the time, or you don't go out too often, or you prepare and go to anywhere you need to go to half an hour early to get to there on time. So I feel like we're not being serviced properly because we're in the inner suburbs, and we're also having this rising cost that constantly affects us. Like I feel like something that's not talked about in our community is abating fare. Like 2 of the people that I spoke to on my focus group said they evaded the fare because they couldn't A, afford it, or B, didn't want to pay that much money. So I feel like why make a fare that's not reasonable to pay for the average poor person in Toronto? If you're poor and you can't afford $3.25, why does that fare exist for us? You know, like let us have a fare that we're comfortable with. So most people, I feel like, would be happy with paying $2. They feel like $2 is a decent amount to contribute to society. Anything above that is just asking for it. And let's talk about $2 for the adult. The student probably would love it to be even cheaper, $1.50. You know?
Yeah, and when we talked last month, I think it was, we talked about how the $2 is the cost of the low income pass, but it's not affordable enough for everyone, but it's also not accessible to enough people right now. So right now you can apply for the low income fare pass if you receive Ontario Works or Ontario Disability Support Program, but and also if you receive a childcare fee subsidy, but the city hasn't yet rolled it out to all low income people in Toronto.
I feel like the best way for the city of, like, I guess one method we should have is most Somalis in my community take child benefit because it just comes to them naturally. They apply for it. And I feel like if you are taking child benefit, shouldn't that be enough indicator that you're poor enough that you can't afford public transit? So like, I think the city of Toronto should make public transit cheaper for those that have a child benefit. So if your child is on child benefit and the government is giving you money, then maybe that child and yourself should be able to get cheaper transit. And another thing is most people don't even know how to like go fill out the forms or fill out the application for it. But I do feel like making, like, my mother is as poor as me, but somehow, some way, she will not be able to access this cheaper subsidy program because she's not on Ontario Works, she's not on disability, she's not having a child in daycare, but she does take child benefit, and she's low income. Like, I don't see why that I have to get this, because I get like discount because my child's in daycare, but I think my mom just supports me, and my sister just supports me. So I think the best way to do it is making sure we do a tax-based system. So if you earn over this amount, you get low income access to
Totally.
bus. you
That's
know?
exactly so the city is right now, I think we'll see if it's delayed, I guess, right now, but they are right now establishing a means testing system based on your income for the next phase of the low income pass. But you're right that there are existing programs that could be used. I learned a lot from reading your master's paper, just some of what you've already talked about, but then also reading like the focus groups and their answers. So where can people check out the research that you've done through focus groups and interviews with people?
I have my paper on academic.edu. So if you go on academia.edu and write trans equity, the Somali experience in Toronto, my paper will come out. My name is Zainab Hussein, and you can read it. My paper is called Trans Equity, the Somali experience in Toronto.
Awesome. And I'll make sure to post a link too in the YouTube video. Um, Maybe the last thing I wanted to ask is just what needs to change in the TTC and also public transit in general to better serve the Somali community in Toronto.
I believe the TTC should first hire Somali workforce. Something about not being in the system helps us not know. Like most Somali people do not work for the TTC. I don't know why they don't have a job in there. Like I don't even think they even know how to get their job. Like my older brother actually wanted to work for the TTC, and I don't think he just gave up because now he works for Bell, but he doesn't know how to. So I feel like getting people jobs, whether they want to be bus fare, whether they want to drive the buses, or whether they want to work within the organization, the more people that work within it, the more we feel like there's a conversation happening between the TTC and the Somali community. Whereas now we just feel like the TTC people are separate from the Somali community. We feel like outsiders for everything. So we don't feel like we're connected to the fabric of society. We don't know if we have a voice. We don't know we don't know if the TTC cares about our needs specifically. Another thing I think the TTC should do is work with Toronto community housing. My research found out that most Somalis live in Toronto community housing. So if we know that we live in Toronto community housing, and if we know that we're an ethnic group that tends to stick together, so there are areas within government housing that we predominantly live in, such as Mabel, the 49 Mabel building, such as the 44 Willard building. There are buildings that are Toronto community housing that have a large significant Somali population that are within Toronto community housing. I feel like why don't you come to the Toronto community housing that the Somali community lives in and have the meetings downstairs? Like I find it crazy that the politicians are able to have voting. Like I went downstairs in my building to vote for which politician is in there. Yeah, we have to go through so much hurdles to talk about the problems we have. I feel like the way politicians reach out to the voters to get votes, because I feel like democracy is not necessarily about people voting; it's about people talking and people feeling like they're connected to the society. So, I feel like if the Toronto community, if TTC officials want small community to be involved, they should work with Toronto community housing. They should get public meetings within Toronto community housing. They should invite small community. They should get Somali workers to help recruit the Somali community. They should also go work with Somali-based organization called Medenta. Medenta is a Somali community organization. They do a really good job in getting the Somali community to come to events that matter. And so they can probably help recruit the Somali community. And I feel like getting the Somali community to speak is the most important thing. And also understanding that we need interpreters in these events because the Somali community do not speak English language. My mom doesn't speak English language very well. My dad doesn't speak it. So we need interpreters and people that are able to translate what the people want to talk about. So um I feel like we're just now most Somali people just not do not think the TTC is something that like they think it's separate from them. It's bigger than them. They don't really think it's something that they can work with or they have power over. And that's kind of sad because our daily life is TTC. So it's like we take the TTC all the time, yet we feel like we have no say in it because we feel like it's bigger than us. So I feel like the best thing the TTC officials can do is make it like come at our level and understand that we love to talk and we're very social people and bring the best foot forward and bring good faith when you're talking to the small community.
Great. Thanks so much for sharing all of your research and your ideas with us. Is there anything else you'd like to add before we sign off? And I'll make sure to post the link to your paper. Um,
I guess the biggest thing that I want to like say is that our community is not necessarily a unique community experience with public transit. I feel like a lot of other communities could have, but I was making mine as a case study. This is a large community. We live in City 3. Hachansky wrote a research paper that that the city of Toronto had 3 different experiences to public transit. And so he said City 1 was a city poor, and they had 1 public transit experience. And then City 2 was mid-range. It was like Yonge and Eglinton. It was like Midtown. And City 3 was inner suburbs. And I feel like when I did my research, I was like thinking, you know what, the Somali community lives in City 3. Let's see what they think. So I came from a perspective of saying, let me put my community's voice there, because I haven't really seen research in Toronto about the Somali community's experiences. So I decided to do research because I wanted to know what their experience was, and a lot of it helped me because I was able to relate to a lot of the people. When they talk about cost of bus fare, I was able to relate to myself and say, as a student, I struggle paying bus fare. When I do my research, I also learned a lot about myself, and I realized, you know what, that our problems are all the same, like, and it kind of like gave me empowered me, because I realized that no, we all struggle to pay this ridiculous increase in bus fare. We're all struggling to commute. We all feel like we're taking the bus way too long. Like, one of the respondents told me that he feels like he's traveling all the time, or he's on the bus all the time for such a long time. And I feel like I relate to him, because I'm like, yo, I feel like if I travel to TTC, on the TTC, I feel like I'm there forever, because I feel like from my house, I'm not going a 5-minute distance. I don't have, like, we live in like areas that are not walkable. So the best thing we need to talk about is, why does Somali community continue to be neglected and continue to be overlooked within the transportation planning meetings? And it's because we're not the biggest voices. We have so much other problems, such as gun violence in our community. We have poverty. We have mothers stressed about raising their kids, that we just deal with TTC as something that it's like, okay, it happens to us, it is what it is. And I feel like we now need to look back and say, we want TTC to help us in the problems we have.
Amazing. Thanks so much, Zainab. I've been speaking to Zainab Hussein, who recently graduated from York University's Masters of Environmental Studies program, and you can read her research at the link below. And I've been speaking on behalf of TTC Riders. We're doing a series of interviews during COVID-19 to talk about what we need from public transit right now and moving into the future. So thanks so much.
You're welcome. Thank you.